Welcome to Healing Horizons, the podcast where we explore the powerful potential of ibogaine therapy to heal and transform lives. I'm Chris Daniels, your host, and I'm thrilled to guide you through today's episode titled Beyond Addiction: Exploring Ibogaine's Potential for Treating Eating Disorders. While ibogaine is often celebrated for its efficacy in addressing addiction, its potential to help those suffering from eating disorders remains an underexplored frontier. This episode aims to shed light on this remarkable aspect of ibogaine therapy. To begin, let's examine the landscape of eating disorders in society. Currently, millions of people worldwide struggle with disorders like anorexia, bulimia, and binge eating. These conditions are more than just issues with food. They're deeply intertwined with emotional and psychological factors such as trauma, anxiety, and low self-esteem. Many who suffer from eating disorders experience a complicated relationship with food, using it as a coping mechanism for deeper emotional pain. Despite the prevalence of these disorders, traditional treatments often fall short, primarily focusing on the symptoms rather than the root causes. This is where ibogaine therapy enters the conversation. Originating from traditional healing practices in the African regions, particularly among the Bwiti people of Gabon, ibogaine is a psychoactive substance derived from the root bark of the Tabernanthe iboga plant. It has gained attention in recent years for its transformative effect on individuals struggling with various forms of addiction. However, its application extends beyond this, offering a fresh perspective in the treatment of eating disorders too. But why ibogaine, and how does it differ from conventional treatment options? Unlike conventional treatments, which often focus on diet management and cognitive behavioral therapy, ibogaine therapy targets the psychological and spiritual elements of healing. It facilitates profound introspection, allowing individuals to confront and process the emotional traumas and psychological issues at the core of their disorder. On a biological level, ibogaine's action in the brain involves resetting neurotransmitter systems, which can disrupt patterns of addiction and compulsive behavior. This can be crucial for someone trying to overcome a compulsive relationship with food. The scientific community is increasingly uncovering how ibogaine acts on the brain. It's known to interact with several neurotransmitter systems, including serotonin and dopamine pathways, which are essential for regulating mood and behavior. This action helps rebalance brain chemistry, reducing cravings and enhancing emotional resilience. Moreover, the intense introspective experience during an ibogaine session often provides users with new insights and perspectives on their relationship with food and self-esteem. But the most compelling data comes from the transformative personal stories of recovery. Let's dive into one such story. A story of hope and recovery through ibogaine. Jane, a former client, battled bulimia for over a decade. Traditional therapy offered her little relief, and she often found herself trapped in a cycle of self-loathing and binge-purge behavior. Through ibogaine therapy, Jane experienced a profound awakening. It enabled her to reconnect with repressed memories and traumas hindered by her disorder, facilitating emotional healing and forgiveness. Post-treatment, Jane not only regained a healthier relationship with food but also reclaimed her self-worth and purpose. The role of trauma cannot be overstated when discussing eating disorders. For many individuals, these disorders stem from deep-seated traumas, whether from childhood, societal pressures, or negative self-image. Ibogaine therapy seeks to address these underlying issues by providing a holistic healing experience that targets not just the brain, but also the emotional and spiritual self. This holistic approach integrates nutritional guidance, therapy, and community support, fostering a comprehensive recovery path. However, it's essential to note that ibogaine therapy is not without its risks and challenges. While promising, it is a potent psychoactive that requires careful supervision from medical professionals. Potential risks can include cardiovascular issues and psychological distress, underscoring the importance of choosing a reputable treatment center and undergoing thorough pre-treatment evaluations. This therapy is not suitable for everyone, and its use must be considered within the context of a broader treatment plan tailored to each individual's needs. For those intrigued by the possibilities that ibogaine therapy offers, numerous resources and support systems are emerging. From established clinics in Mexico specializing in ibogaine treatment to networks of professionals trained in offering integrative and supportive care, help is available for those seeking this alternative route. Before pursuing ibogaine therapy, it's crucial to conduct thorough research, consult experts, and consider all aspects of one's physical and mental health. Ultimately, the potential of ibogaine therapy in treating eating disorders suggests a promising horizon for those desperate for relief. In a world where these disorders are often hidden away in silence and shame, ibogaine offers a path forward, one rooted in profound personal exploration and liberation. We hope today's episode serves as a beacon of hope, encouraging listeners to explore alternative pathways towards wellness, self-acceptance, and lasting transformation. Thank you for joining us on Healing Horizons today. We've ventured beyond addiction to uncover ibogaine's potential in treating eating disorders, spotlighting its holistic approach that encompasses science, spirituality, and personal transformation. As always, our goal is to illuminate alternative healing pathways that empower individuals to reclaim their lives. Remember, healing is a deeply personal journey, and we're here to support and guide you every step of the way. Be sure to tune in to our next episode as we continue to explore fascinating topics and stories of healing transformation. Until then, take care and be well.